Hello, Dr. Brown.
Hi, nice to meet you.
Nice to meet you.
Hi, Steve Brown.
Steve Brown, yes, from PCI Orthopedics.
PCI Orthopedics.
Yes.
Chris, aren't we on the Move Well, Live Well?
We are on the Move Well. Am I not?
That is not
Is
the
this
right
incorrect?
thing. That is absolutely incorrect. That is
Okay.
on the do not.
I'm on the do not list.
That is on the do not list
Okay.
of things to do.
All right. So
All right.
we're going to talk about backpack safety.
Okay.
So I'm the don't.
You're the don't.
So let's talk
Let's
about the
get
do's.
parents engaged into the do's.
The do's.
The
Okay.
do's.
Should
Okay.
I do this first?
Yep. Two
before?
straps. Yep. I
There
love
we
it.
go.
All right.
Oh, you know that feels much better.
It does, right?
Yeah.
It evens out the weight, distributes
Yes.
it, so you have
I'm not
less
walking
back
like
pain.
this.
Exactly.
Okay. Perfect.
So, I mean, we know that 71 million kids are going to go back to school this year, okay? They're all going to be wearing backpacks. We recently did a study and looked at those, and over 50% of those kids' backpacks is over their allotted weight, which wearing backpacks either improperly or too much weight can lead to stress of the neck, the back, and even the lower back, creating postural dysfunctions, which leads to inherent extra care with, the parents, anxiety, going to the physician, out of sports, et cetera.
Yeah. How do you choose the right backpack?
Yeah, so that's a good question. So there's lots of different ways to do it, and no one answer is exactly right, but there are some basic standards that we try to follow that I'll educate my patients on. Number one, the size of the backpack. Bigger isn't always better, right? Because we want to limit the weight of it,
Right.
okay? Number two, all right, you want something that's going to help distribute the weight out. So something with two shoulder straps that we were just talking about, okay? So 1, 2, okay? Ideally, one, two.
1, 2,
I see you are missing two things that we'll recommend.
Okay.
All right.
What's that?
So the two things, a chest strap if you can.
Oh, I think I have
all right?
that. I think it's just, I do have, no?
No,
Do I have
I
that?
don't
Oh, I
think
don't
so.
have that. Okay,
and then
never mind.
a waist strap, because that will certainly help
Okay.
distribute that weight.
Okay.
In addition, also like something like a padded sort of back will help that impact as the kids are walking.
Okay, yeah, because those textbooks can get heavy. Do
They
they
can
still do
they get too
textbooks?
busy.
But if they do, yeah, they do get,
They do still
they
get
get very
textbooks, I
heavy.
think.
All right, so I'm now wearing this properly.
Yeah, so
Correct,
something
yes,
we want to look
but
at.
with-
So wearing it properly, essentially you want it about 2 inches from the shoulder and then at your waistline right there, all right?
Okay.
And then when you're actually tightening it up, you want the shoulder straps nice and tight, and then if you have a chest strap or a waist strap, it'll actually bring the backpack closer to the back and help redistribute that weight a little bit
Okay.
easier for the child.
And how do you know if it's too heavy or if it's too much?
Yeah, so we've done studies on this, and what we've looked at and what has come out of those studies is anything essentially greater than 15% of a child's body weight
Okay.
is too heavy.
Okay, so this is not too heavy for
So
me
your average,
right now.
your average child that weighs, in 7th grade, that weighs 100 pounds,
Right.
anything more than 15 pounds
Okay.
is kind of the max that we recommend.
All right, what tips do you have for parents?
So I think for parents, it's about, decreasing the body weight, okay, or decreasing the weight actually in the backpack, okay. So number one, frequent stops at the locker,
Okay.
having the kids in between classes, dropping them off, picking up new books.
Not putting all your books in the backpack
Yep,
and just going class to class.
For
Okay.
one day.
All right.
And having kids myself, I know they'll come back and Tuesday's books are still in there for Friday classes. So
I was guilty.
yep,
Yeah.
unloading those backpacks every day
Okay.
is helpful.
All
In
right.
addition, how the kids pick up the backpacks. You want two arms, you want to squat, kind of pick them up.
Mm-hmm.
Too many kids are just leaning over, picking them up. And then again, appropriate wearing.
Yes, and not this.
Not like
Not
that,
that.
no.
That is the way in the 80s and 90s that we would.
It is still probably
Yeah.
the cool way, but not the
It is.
appropriate way. And
And-
we don't need more back pain in kids.
And I wonder why I have back pain now.
Yep.
And shoulder pain now.
Yep, exactly.
All right, so that's a good way for kids to kind of avoid that back pain
Yep.
issues. There's also other growing pains, not the sitcom growing pains, or not the
Not the
life
80s
lesson,
sitcoms.
right? Not
Yep.
the life lessons growing pains, but actual pains that these kids are having. Can you tell us what those are?
Yeah, I would love to. I see a lot of that in my pediatric orthopedic clinic. I get lots of parents that come in and they're concerned of this pain. The pain is typically in children under between 2 and 12 years old. They've seen their pediatrician. The pediatrician, labels that as potentially growing pain, which then prompts a referral to us. In my mind, growing pains really come in two sort of broad back categories. Your first traditional sort of growing pains, which those kids are normally between ages 2 and 8 haven't really gone through too much of a growth spurt. Those, we've kind of getting away from the nomenclature of growing pains, and these have more recently kind of been labeled as idiopathic, benign, nocturnal, meaning night, limb pain in children. Okay, I think that more accurately sort of describes what's going on. Happens at night, it's idiopathic, we're not really sure of the cause, benign meaning there's no long-term consequences. The second sort of growing pains are the kids that are actually going through a growth phase, okay? And most of those are actually going to be tendinitises, apophysitis, and that's an imbalance of your bone growth relative to how fast your muscle and your tendons can grow. Growth plates go up and down with their growth. So when you hit a growth phase, those bones grow really fast, and unfortunately the muscle, the tendons that are hooked to growth plates can't grow fast enough. So any one of those mechanisms can get irritated. Those are certainly two different sort of, quote, growing pains that we would see.
At what point should a parent actually seek medical advice for these growing pains?
Yeah, so anytime a kid has a pain, you know, for an extended period of, you know, time, that you want to come in to see us. Our main job, at least from an orthopedic standpoint, is make sure there's not something more organic going on. So more high-risk things would be, you know, pain that's lasting throughout the night. A patient has like a limp the next day. If they have a hot, swollen joint. Things that are physiologic, meaning normal, tend to be symmetric. So in these growing pains, they tend to be in the thighs, they tend to be behind the knees, in the calves, or in like the shin area, both legs. If things tend to be asymmetric, they tend to be pathologic. If a kid had an injury, that would be another sort of concern. And so any of those sort of red flags, you'd want to come see your pediatrician and or maybe an orthopedic evaluation.
How can parents help alleviate the pain for children who are going through the growing pains?
Yeah, it is really difficult, frustrating, and as a parent, it's hard not only on you, but especially your child when they're having pain night after night, Things that have been proven to help, is stretching, stretching everything in the lower extremity, your quadriceps, hamstrings, and your calf muscles, in the morning and at night after activities, Number 2, warm baths at night have been shown to help, Number 3, like warm compresses, so taking like a warm cloth or something, laying it over a child, and massages. And I hear a lot of moms and dads come and say every night that seems to put the kids to bed. You know, the main thing about both of these is they're both, most of my job is parental reassurance. Most of them really don't need any sort of actual surgical intervention, but we can certainly help treating the symptoms. They tend to always get better. There's normally nothing, you know, permanent, any sort of a damage, but it's hard when it lasts for months or even sometimes years.
Thank you very much, and I will put my backpack on appropriately from now on.
I appreciate that.
Yes, thank you very much, Doctor.
You're welcome. Thank you.